Good day, Dr. Olurotimi, Badero.
Good day, Mr. Aina.
Do let the reader know more about you and what you do.
Well, first of all, I want to thank you for this opportunity to be here. I thank God, for the opportunity to obviously be alive and also be in Nigeria, where I think a lot of great things are being done as it is, and we're hoping that the country can continue to maintain the upward trajectory that I think it's on right now. My name is Rotimi Badero. I'm a physician. I'm a cardiologist, both general and interventional. I'm also a general and interventional nephrologist, as well as a peripheral vascular specialist.
Okay.
I started my early education at St. Mary's Private School. That's somewhere in Lagos. And after that, I attended Federal Government College Udubulu for my secondary school education. On completion of that, I gained admission into the medical school at University of Ife, now called the Bafemi University, College of Health Sciences. And I did my housemanship year, or the internship year, at the same university hospital. And then when I finished that, I did my mandatory 1-year National Youth Service Corps in Lagos. I worked at General Hospital in Missoula.
Okay.
When I finished, I moved to the United States to further my training, postgraduate medical education.
Sir, why did you decide why did you decide a profession in your medical field?
Well, I mean, I've been asked these questions a couple of times before in the past, and it's very interesting. I never wanted to be a doctor, actually. I had two professions that I really wanted to. I was very good at fine arts when I was in secondary school. I loved to draw. Excuse me, I believe that art is a very good form of expression. I think we all have a fluid mind sometimes that needs to be expressed to the outside world, and art is a very good medium to do that, where you don't have to be politically correct and you're free to express yourself. So that's one thing about art, and I wanted to be an artist. Secondly, but firstly, I wanted to be an engineer. I wanted to be a mechanical engineer, and my dad wanted me to be a physician. I rejected the idea initially, and after so much talks and discussions, and I was still very adamant about being a mechanical engineer, my dad called me one day, one evening, into his room, and he talked very openly with me. He told me how much he loved me and how much he wanted the best for me, and that if I studied medicine, I would do something no one has ever done before, and that his blessings will be with me. So that was a turning point, because I wanted my dad's blessings, and that was actually the reason why I decided to study medicine. And initially, when I first started, I wasn't the most ideal student, because I never used to attend class, and because my mind was not in it. I used to play around a lot, and then eventually I started getting involved and being serious about it, because you see, whatever you do, whatever is worth doing is worth doing. Whatever is worth doing is worth doing well. So if you decide to do something, you're going to invest your time, and people are going to spend their money. Then you should be serious about it. So eventually I became very involved in medical training.
Okay. You are the only medical doctor with a combined expertise as a heart and kidney specialist doctor in the world. How did that come about?
Well, it was. I think it was purely by divine intervention. It was not something that I set out to do or to achieve. Most of my training and in my career has been fraught with a lot of challenges at every stage, right from my primary school education, trying to get into private school, up until my secondary school, up until my university level, and even all my postgraduate training that I did in the United States has been met with a lot of challenges at each step. I originally wanted to be a cardiologist because I was fascinated by the heart, but there was some resistance, and I wasn't given the opportunity initially to train as a cardiologist. Even though I was very well qualified and I was top of my class during my residency training, but I didn't let that deter me, because I believe that if wherever you're going to get to in this world, God will get you there. Once you believe in God and you believe in your ability, and you stay true to yourself, eventually you arrive at your destination. So I kept on. I persevered. I had to train initially as a nephrologist, and also as an interventional nephrologist, and then eventually the opportunity came, and so I took it, even though it meant spending so many more years, and which had a lot of its challenges, because the programs are very rigorous, very time consuming, and you have to be very focused and stay the course. So eventually that's what happened, and I found myself doing both fields.
How challenging has it been? How challenging has it been?
I mean, the training or after
the training and after that?
Well, I mean, it was very, very challenging. It was, to say the least, it was very challenging. First of all, coming from Africa, going to the United States, there's a lot of things that you have to kind of get used to. Nigeria is a tropical environment. The United States is a temperate environment. You have to get used to the weather, which sometimes can be challenging. You have to get used to the culture, because the culture is very different. The language is very different. A lot of times when Nigerians go abroad, and then you're trying to speak, people don't understand you very well. So imagine you're in school and they don't understand what you're saying as well because of your accent. You have to get used to the food. And also the medicine is very different. In America, it's evidence-based practice. In Nigeria, it's not entirely evidence-based. A lot of things we do in Nigeria, there's no evidence, medical literature, medical evidence to do those things. So you're trained in Nigeria to, for example, look at a patient and try to figure out what's going on before you decide what tests are needed. In America, it's very different. The tests are ordered right away. So you have to kind of get used to that. So those are the logistical challenges, but also you're a black person in an environment that is dominated by the Caucasians. And so that comes with its challenges as well, in both ways. The training is very, very rigorous, and so that's also very challenging. And then I was fortunate and blessed to train in very good institutions that are very challenging to get into. So that also comes with its own challenges. And then when you get in there, the expectations that they have for you is very different. And for me, the expectations that I have for myself is very different. I always tell people that I look into the mirror every day and I see the person I'm up against. I'm only up against myself. I'm not up against anybody else, because you're your own greatest critique and your own greatest, how would I put it? Your own greatest supporter and your own greatest critique. So for me, I have a different expectations of myself, but there's also an expectation of the institution, of the people that you're working around. And what I have noticed is that a lot of times, as a black person, especially as an African, the preconceived expectation of you is not so high. And that bothered me initially. But then I got to look at the obstacles, not as challenges, but as opportunities to make a difference. So it became easier for me once I looked at things that way. You can look at a block as a stumbling block, or you can use it as a stepping stone to leap yourself to greater heights. So all in all, those are the kind of challenges that I faced.
So to the next question, you recently or some months ago, a while back, you were awarded at the U.S. Senate, right? If I'm right, could you clarify how did it come about?
Well, that was a National Merit Award given by the United States Congress.
Okay.
So it's a U.S. Congressional Award, which is I'm honored and humble to have received, because it's a huge award in the U.S. Again, it's only God. Anything that we are today or we do, any accolades or any distinction that you get is something that is that comes from the Almighty. It's not because of what I've achieved, really. It's not because of what I am or what I've done. Because you don't do anything by yourself. Everything is collective. So I was surprised when I was given the award. I was thankful to God. But basically, they looked at the things that I've done, and the award is not an award that I take upon myself solely. I think it's a shared award that I share with the people that have invested in me, like teachers, the people that have trained me in the past, right from my primary school education, because you can't get to secondary school without having a primary school education. You cannot become a doctor without having a secondary school education. I couldn't have gone to the US to train as a cardiologist, as a nephrologist, without having the foundation medical training which I received at IFE. And if you remember those days, most of the training were free. We used to go to school for free. So I don't take any of those things for granted. So what I've achieved today and this award and everything actually is a shared award with all the people that have been able to train me and invested their time and resources and energy for me to become, to get to where I've gotten to today. And again, none of this will have been achieved without the mercy and faithfulness of God. So I'm just thankful for the opportunity.
So the next question. When you got the award, did he propel you? Did he propel your name globally? Did you notice any
well,
global...
quite interestingly, a lot of people are not even aware of this award because it's not been highly publicized. And again, I think that also is due to my personality. I'm not one that likes being in the limelight or likes being in the news, things like that. I'm a very private person, but I wouldn't say it has made any difference in terms of like, for example, a lot of people in Nigeria, they're not even aware that, I'm not even sure they're aware that kind of award exists, or nor do they know that I got that award. So to answer your question, I don't think it's really changed anything much in terms of recognition, which really doesn't make much of a difference to me. But hopefully somebody will get inspired by that. Maybe another Nigerian will get inspired by that to be true to their course and try to be diligent in what they do, and hopefully they will get recognized for it.
So the next question, how long have you been in the medical field? And also, how long have you been a combined expert in the heart and kidney fields?
That's a very excellent question. I've been practicing medicine now for close to 19 years. And since I graduated from medical school. And it's been a very interesting journey, a bittersweet journey, one that has ups and downs. But in all, I remain very grateful for the opportunity to take care of the sick and put a smile on people's faces. I always believe that the wealth of a creative mind lies in the ability to make a difference in people's lives. And the ability to make a difference between sickness and health, I think, is one of the greatest wealth you can have. So, the other part of your question is how long have I been a cardio-nephrologist, which is the combined cardiologist and nephrologist. And I just learned this is the first time this is being done in the world as it is, which is a very good thing because the heart and the kidneys are very well interrelated. They're closely related. And I think actually there should be a specialty on its own to train people in these two fields. But I completed my last training in 2010, I believe. So I've been a cardio-nephrologist now for 6 years.
Okay, 6 years.
6 years.
6 years. And how's the journey been so far?
It's been very nice. It's been great. It's been sweet. It's been rewarding. Because I remember when I was a nephrologist, and again when I was a nephrologist, I enjoy nephrology because it's a very cerebral field. I enjoy taking care of kidney patients, but I realized that a lot of the patients were dying from heart complications and heart diseases. So it was very challenging for me trying to take care of these patients and do the best that I could. And they kept dying from something else that I had no control over.
Okay.
So, and when I became a cardiologist, I realized that having those both specialties put me in a very a very distinct position and a very advantageous position because now I could look at the patient more, I would say, with a 360-degree vision. I had a totalitarian approach in looking at the patient, and so that gave me a lot of advantage, as opposed to if I was just a nephrologist or if I was just a cardiologist. So, in that regard, it's been very rewarding because when I take care of patients now, it's very different. I look at things, I see things that that I might not have seen if I was just a nephrologist or if I was just a cardiologist, and it's been translated into good care, good results, and the patients always recognize that, and so for me that's rewarding. Good.
Sir, just to clarify, what makes being an expert in the arts field different from the kidney field in the medical world? Any difference, or they are all interrelated?
Well, I mean, they're interrelated, but there are subtle differences.
Okay.
Nephrology or the kidney field there are not a lot of subdivisions.
Okay.
What I mean by that is, for example, there's general specialty in kidney, which is a nephrologist. There's a transplant nephrologist, and now we have an interventional nephrologist. So those are the three subdivisions, really, specialties in nephrology. Whereas in cardiology, you have a lot. You have a general cardiology. You have you have a non-invasive cardiology. You have interventional cardiology. You have electrophysiology, you have heart failure, you have cardiac transplants. So now cardiology, I think, has been around a lot. More studies have been done in cardiology. There are more cardiologists in the world than nephrologists. The heart is a very central organ. All the organs in the body are very important, but we all know that once the heart stops, everything stops. So putting that in a context and how different it is from nephrology, cardiology is a field that is driven by a lot of testing and a lot of procedures. nephrology is not a field that is driven by a lot of testing and procedures. So although there's a lot of, I would say, molecular level evaluations in nephrology as opposed to cardiology. So if I'm going to look at both of them side by side, as a nephrologist, you do a lot of, write medicines, medications, you take care of disease states. In cardiology, you take care of disease states, you write medications, but you also do a lot of testing, you do a lot of procedures. So that's one of the basic differences in both of them. And the other difference is that cardiology is more of an acute things that you do. There are chronic parts of cardiology, but a lot of time patient comes with heart attack or they're short of breath, things like that. You have to, the gratification is immediate. You take care of that patient, you prevent them from having a heart attack. Something you see right away. With nephrology, is something that you see with time. Somebody has kidney disease, you're managing them, trying to prevent that kidney disease from getting worse. It takes years and things like that from seeing that. Having said that, there are also very acute conditions. The patient comes to the hospital with the kidney disease that you take care of right away, but it's not as common as those of the heart.
Okay. So the next question, as a Nigerian, what are the positive developments you've noticed in our health sector since you left?
Well, I mean, I think first of all, the awareness has improved and has increased within the general populace, and in terms of utilization of medical resources, and also I think some of the medical resources that were not present 16 years ago before I left Nigeria. Now it's a difference. Now you have more medical resources being available. Some of the hospitals now are getting closer to what you have in the developed countries in terms of equipment, and also manpower has also increased. 16 years ago, we didn't have a comprehensive laboratory in Nigeria. Now there is one. I think, I'm not sure who set it up. I'm not even sure it was Nigerians that set it up, but it doesn't matter. We have something that is very comprehensive where you can get any labs and you can get it at a timely fashion. So that has improved diagnostic abilities, treatment, therapeutic options. So that has, improved, in all the healthcare delivery. I think also the government has been more, they've participated more, or they've had a greater role actually in some of these hospitals. Like now we have more of a government and private combined partnerships, which were never really existed before. And I think that's very important, to move healthcare delivery forward in Nigeria.
So, what are the negatives you've seen since you've been in town in the health field, health sector?
Obviously, I'm sure there are negatives, but I don't focus more on negatives. I don't focus on problems. I try to focus on solutions, because I think for a long time in Nigeria we focus on problems. And when you focus on problems, you become a problem-oriented person. Problem seeker, and you're always looking for problems when you actually be looking for solutions. So I'm of the opinion that we should try to solve, things that are here now, and then after that, let's look at the glass as being half full instead of being half empty. But having said that, the challenges, I look at them as challenges. I won't look at them as negatives. There's still a lot of red tapes that need to be crossed every time you're trying to do something. That's number one. Number two is, I think power is central to anything, to any institutional process in Nigeria, both in the financial sector, both in agriculture, both in development, both in infrastructure, small, large businesses, healthcare. Power is central. For example, you can come to Nigeria and set up a private medical enterprise, and I use the word enterprise because it could be a hospital, it could be a diagnostic center, and you have to spend a lot of money to buy diesel to generate your own power, and that money is an overhead that will eventually be transferred to the patients. So you're trying to take care of people who don't really have a lot of funds, and you have to spend a lot of money to do in the process. So if you don't transfer that overhead to patients, eventually you're going to run out of business. So what you're trying to do will not be around for long to do it. So power is one of the challenges that I think faces the healthcare system. And also regularization. I think there need to be some form of regularization. You can't go to this hospital and want to get a treatment for heart failure, and it costs, I don't know, X amount of money, and then you go to another hospital and it costs a different amount of money. So that causes healthcare delivery to be skewed. I'm not saying it's wrong for them to do that, because obviously the location of the hospital and all the things, but I think there should be to a large extent some kind of regularization, which makes it easy for the standard of care and standard of healthcare delivery to be uniform across the globe, across the country, which definitely helps the masses and does not create a tier system or a status system, which I think is very prevalent in Nigeria. I believe that the creed of knowledge and the exchange of ideas in itself, should be something that it should be something that's upheld in any societal construct that we have, and we should always promote that in this country.
Okay, sir. What medical innovations do you believe the health sector in Nigeria is in dire need of? Medical innovations, do you believe?
Well, I mean, obviously I will talk from my experience and my specialty, which is both cardiology and nephrology. I think that covers a lot of internal medicine. So from cardiology standpoint, we, to take care of patients that have heart attacks or heart disease, you have to have equipment to do testing to be able to diagnose these conditions. In Lagos State, I'm not sure if they have more than one cardiac catheterization lab. I know, I know that they have that at the Cardiac and Renal Center in Bagada, which I had the opportunity to tour some time ago, last time I was here in Nigeria. But unfortunately, I think they're having some financial challenges, and the institution is I think, shut down as we speak, because they're looking for government funding. So even though it has a lot of equipment and innovation that can be useful, it's not being used. So I'm not sure which institution actually in Lagos has a cardiac catheterization lab. I know that there's one in Ogun State. I'm not sure if there's one in Osun State. So, but if we put everything together in Nigeria, I'm not sure they have more than 3 working cardiac catheterization labs. So that is one area that needs to be addressed, because it can save lives. Since we know that cardiovascular death is the #1 cause of death in the world, and it's been like that for so many years. So for us to really take care of the #1 cause of death, we have to have the equipment, the innovation to do so. So cardiac catheterization lab, I think, is one of them. Nuclear medicine and nuclear cardiology is pretty much non-existent in this country, and that takes care of patients with chronic heart diseases, especially chronic ischemic heart disease. That is, patients that have blockages in the arteries that are not presenting to you as a heart attack at this point, but you don't have to wait for them to present with a heart attack because you can pick it up earlier and fix the problem. So that also is non-existent from a cardiac standpoint. Then the electrophysiology, which is taking care of patients that need pacemakers, that need things like defibrillators, somebody whose heart rate is very low, like in 20s or 30s, and they have symptoms. They need to have a pacemaker to help them to live. We don't really have that in this country. Patients that have heart failures, the muscles of the heart are very weak, and because of that, they are they're prone to having what we call sudden cardiac death. And what will save their life is having a defibrillator that will prevent them from having this sudden cardiac death that lead from the heart, beating very, very fast. So that's also another field, another innovation that we don't necessarily have in this country. Now, on the nephrology side, there are centers now that have dialysis that can take care of patients with end-stage renal disease, which is good. And I know that there are centers now putting the fistulas that you need to do this dialysis. Interventional nephrology is pretty much non-existent as well, because you can put in these fistulas, and if they don't work, they need to be fixed percutaneously or non-invasive. Percutaneously or non-surgically. That is non-existent in Nigeria. And so you have a situation where a lot of the patients are being dialyzed through tubes, artificial tubes that are put in their neck, and these tubes are prone to having infection. And because the tubes are directly go from the neck into the heart, when it gets infected, the heart gets infected. And when the heart gets infected, that is death. So that is the need. That's why there's a need for this fistula, which is a creation between a vein and an artery that is not subjected to infection. It's not been done in a lot of centers, but even when it is done, there are inherent problems that needs to be recognized early and to be fixed, because if it's not, that fistula will close down. And then you have to now go to another part of the body to create another fistula. This is where interventional nephrology comes into place, because we can take direct visualization of that fistula, find out where the problem is, and using balloons and stents, we can open it up and preserve that fistula so you have longevity. So in the area of nephrology, that's, and also transplant. You can't mention kidney care without talking about transplants. I know that they do some transplants at one hospital in Lagos. I know it's being done at the teaching hospital in Ife. I think it might be done also in Abuja. But this is something that should be done in a lot of centers around Nigeria. People leave Nigeria to go to India to get a kidney transplant. They go to South Africa to get a kidney transplant. I don't see a reason why they need to be going to all these places. If we have an effective center that has the right resources, that has the right manpower to take care of these patients in the standard that is accepted globally.
So with all what you've mentioned, then that means there's a business angle to what you've mentioned, isn't it?
Well, there's always a business angle to anything. As a doctor, we're not trained to look at business angles of things. We're trained to take care of patients. But as an entrepreneur, because I have my own practice in the United States, so I've learned also to know about the business of medicine. In medical school, nobody teaches you the business of medicine. They don't teach you the financial aspect of medicine. They don't teach you the legal aspect of medicine. They only teach you the medicine of the medicine. And when you go out, there's one thing you learn in America very quickly is the legal part of medicine. And then if you own your own practice, you learn about the business aspect of medicine. So there is business to everything that you do, except you're running an NGO. If you're running an NGO, then you don't have to worry about the business. But with people comes finance, because people, the strength of finance also is always in the strength of numbers and the strength of people. That is why China is very strong today, because it has a lot of people. So anytime people utilize a resource or a service, that's a monetary exchange, and that's business right there. So when you bring all this innovation, there's medical tourism in Dubai. And that's a business aspect. It generates a lot of money because people go to Dubai for, checkups and whatever it is that they have. I don't see any reason why we cannot have a medical tourism in Nigeria, because we have 130 million people, I think, in Nigeria. 170 million, 200 million. That's a lot of people, and that's why Nigeria is being considered as an emerging market globally now. So we have a lot of people. That means the utilization rate of any resource is going to be high. So there's a business aspect of medicine that can be tapped into Nigeria, because if we have centers that provide adequate health care, that people don't need to travel abroad to get their health care, and they stay back in Nigeria, it's going to generate a lot of financial resources and financial revenue, both for the government sector and the private sector. And so that is something that definitely should be looked into, both by the government and by the private sector. And I think there should be more public-private partnership, what we call PPP. Government putting down infrastructure, private investors also running the institute, because historically, you've had a lot of what I call shell hospitals, or shell institutions, where there's a big infrastructure that has been put down, and within 10 years, there's no maintenance culture. It's non-existent. You spend all this money putting all this infrastructure in place. There's no maintenance culture. There's no vision to maintain it. And then you move to another place and put another infrastructure. What we need is not infrastructure. We need manpower, and we need a maintenance culture that can maintain what we already have, and the knowledge transfer. To train people to maintain that standard.
So, one more question, or two more questions. You are making giant strides in the West. Have you begun, or are you making impacts in the health sector in Nigeria? Or even if you are, in what field, or is this something you're thinking about?
Well, let me.
Or you don't want to talk about it for now?
Oh no, I can talk about it. Let me to answer that question. Let me go back historically into the past and how we got here. I grew up in an era of political contestation that was fragmented by dominant military disposition, where heated political discussions were had everywhere. The military hegemonic oligarchy used to be once a dominant political construct in Nigeria, and I'm glad that has faded to the dust of political history, and that it's a distant memory whose existence is difficult to imagine now. So what I mean by that is that many years ago we didn't have a stable political construct, a stable political institution. That did not give a viable environment for things, for not only for you to have a thriving healthcare institution, but also for people in the diaspora to come back to Nigeria to come and give back. Because if you don't have a stable political environment, people are not going to come back because of safety and for other reasons. So that's why I go back in time to mention that. Now we have, albeit a stable political environment, so now you're having more people coming back from the diaspora to try to give back. And that's one of the reasons why I've been making a lot of trips within the last 7 months. I've probably been in Nigeria 3 times because I feel indebted to this country. I feel that my medical journey started here. My medical training was pretty much free. when you train in the United States, you realize that it costs an average of $250,000 for someone to go to medical school. You get that education for free, even though you work hard for it. So I believe that a circle of knowledge cannot be completed if you don't come back to the source. You always start from a point A. You can go to point B, point C, point D, but to complete that circle, you have to come back to A. So I believe in giving back very strongly, and that's one of the reasons why I began to make trips back to Nigeria, because I want to give back to the country. I want to use whatever God-given abilities or expertise that God has been blessed me with. I've been fortunate to be able to help the people, because I don't think there's any point just using your knowledge to help other people in other places, and you can't help your own people that you started with. So having said that, I've tried to initiate talks with both government, state governments, and hopefully with the federal government, and also with private institutions as well, to see where my expertise can be utilized in a way that is helpful to, to the Nigerian population. So that is an ongoing process, and it's something that I'm very passionate about. Lastly, I'm also involved in medical mission work. I've been to places in Santo Domingo, in Dominican Republic, and other parts of the world, where we do medical missions for free, and that's something that's a passion of mine. Also because I'm a Christian, and so that's also something that I would like to see being done in Nigeria as well, because there's always a place for that.
One final question: what book are you currently reading?
It's called the King James Bible.
That's a good one. Thank you very much for your time, sir.
Thank you.